The physiotherapy interventions. Introduction to the module. This module explores the relationship between a physiotherapist and their PTA, physiotherapist assistant, and the necessity of interventions in practice. Topics to be covered. The relationship between physiotherapist and physiotherapy assistant. Interventions used in physiotherapy. Therapeutic exercise. Physical agents. Electro-therapeutic modalities. The relationship between physiotherapist and physiotherapy assistant. A physiotherapist, or physical therapist PT, works to promote health, well-being and to restore function and mobility to their clients' bodies. Helping to support them in this profession is the physiotherapy assistant, PTA, an appointed healthcare provider and colleague who will assist with implementing and monitoring physical therapy programs. A PTA will provide interventions whilst being supervised and directed by the PT. An intervention is the professional term given to the individual physical therapy programs and activities applied to a client. Only change or amend an intervention if told to by the PT. Update the PT with any concerns or observations. If an intervention is being held outside of the therapy environment, and a PTA is performing it whilst at a remote distance from their PT, the following conditions must be in place. The physical therapist must be immediately available for contact, and the physiotherapy assistant must have the ability to communicate directly with them at all times, for emergencies or guidance. Regular updates and conferences must occur between the therapist and the assistant, depending on the circumstance and treatment being applied. Where a client is being treated off-site by an assistant, the therapist must schedule a time to visit the client's location. This supervisory visit by the therapist should take care to include the following considerations. Another full examination of the client. A full review of the treatment being currently provided, along with the client's current progression to their fitness goals. An evaluation regarding the potential involvement of other professionals or resources in addition to the current program. Interventions used in physiotherapy. Physical therapy management will be organized by physiotherapists and depend upon the nature of a client's impairment, the clinical diagnosis, and available resources. A PTA will then administer the approved intervention to the client according to the findings and conditions laid out by their PT. In this case, the intervention will be classified as the direct interaction or set of activities that are applied by the PT to the client. This may take the form of electrotherapy, physical agents, heat pads, ice packs, etc., or therapeutic exercise. During most physical therapy programs, the use of therapeutic exercise is seen as the most effective and essential form of procedural intervention. Therapeutic exercise. Therapeutic exercise is defined as being the planned and scheduled repetition of bodily movements and physical activities. This is designed to directly assist a diagnosed client in the process of recuperating and preventing mobility loss, restoring physical movement to an acceptable standard, providing protection from potential health risks, balancing health, fitness, and general well-being. The exercise recommended is likely to involve forms of endurance exercise, aerobic movements, agility and balance training, body mechanics, coordination and developmental activities, locomotion and motor training, muscle and flexibility exercises, neuromotor development, stretching and relaxation exercises and more. All physical therapists will only advise and oversee the use of therapeutic exercise when it is confirmed as being appropriated during a full evaluation and diagnosis of a client. Ideally, the evaluation will also identify the exact type of exercise that will be of most use and the schedule that will be assigned to the client. Indicative symptoms of a condition will be found in the following systems of the human body: cardiovascular, metabolic, genitourinary, integumentary, multiple systems, musculoskeletal, neuromuscular, pulmonary, Depending on the classification of the condition or injury, a client can expect to have the following subtypes of therapeutic exercises being scheduled for them to take. Aerobic movements. Water-based exercise routines. Gait training. Working with gradually increased loads. Energy conservation training. Mobility propulsion programs, wheelchair, etc. Agility and balance training. Mobility development training. Motor function training. Neuromuscular education or re-education. Perceptual and sensory training. Posture awareness. Standard repetitive exercise. Performance training. Vestibular exercises. Body mechanics. Body mechanics training. Posture control. Posture stabilization exercises. Posture awareness training. Flexibility exercises. Stretching and muscle lengthening. Motion practice exercises. Locomotion training. Development training. Gait awareness. Device training. Perception training. Standard exercise approaches. Wheelchair training. Neuromotor development. Development training. Motor training. Movement pattern awareness. Neuromuscular education. Relaxation exercises. Breathing techniques. Movement strategies. Relaxation positions. Standard exercise approaches. Endurance and strength training for head, neck, limb, pelvic floor, trunk, and ventilatory muscles. Resistive exercises, concentric, isokinetic, isometric, etc. Water-based exercises. Standard exercise approaches. Performance training. Physical agents. When referring to physical agents, physiotherapists are describing routines that will incorporate certain types of energy, acoustical, aqueous, or thermal. These will be incorporated into treatments to provide additional benefits to existing interventions. APTA will typically be used to reduce swelling or inflamed body areas, stretch muscles and connecting tissues, increase the healing potential of bodily tissues, alleviate pain, incite improved movement. Physical agents are primarily utilized to complement therapeutic exercise and can help improve strength, endurance, and the range of motion, ROM, that may be impaired in a client. The most common physical agents in use by physiotherapists and physiotherapy assistants are: for thermotherapy, heat-based treatment, dry heat, hot packs, paraffin bath, short-wave diathermy; for cryotherapy, cold-based treatment, cold packs, ice massage, vapor coolant spray; for hydrotherapy, water-based treatment, contrast bath, whirlpool; for sound agents, sound-based treatment, phonophoresis, ultrasound. Electro-therapeutic modalities. Electro-therapeutic modalities can be compared to the uses that physical agents are put to, accepting the fact that their effects come from electric sources. They can benefit a client's intervention by directly stimulating muscle movement, assisting mobility, maintaining bodily strength and circulation after injury, performing pain control, reducing inflammation or swelling, encourage healing properties. The PTA will typically utilize these techniques under their PT's direction and use them to improve muscle and physical performance, overcoming any form of impairment. It may also be used to complement therapeutic exercise. The forms of electrotherapeutic modalities will include biofeedback. This uses medical equipment to measure bodily functions such as heart or breathing rates. With the data gained, a client can gain awareness of the function and work to positively change the results with continued monitoring. Electrical stimulation. This primarily uses equipment to safely stimulate muscles with a measured electrical current. This will have the effect of contracting a muscle or providing additional nerve stimulation. Biofeedback requires the client's mental and physical concentration, whereas electrical stimulation can restore movement in underused or wasted muscle tissue regardless of the client's current fitness. Summary. This module has covered the following points. A physiotherapy intervention primarily consists of the interaction between a PTA and a client, with direction from a PT. Therapeutic exercise is the foundation of most interventions and treatments that a registered PT will organize for a client. Physical agents use elemental energy sources to stimulate or soothe body tissues that are impaired or recovering. Electro-therapeutic modalities use electrical power sources to improve muscle and neuromuscular impairments and restore body movements. Biofeedback increased body function awareness, whereas electrical stimulation will cause muscles to contract and move.